Good morning, everyone. On behalf of the Washtenaw Health Initiative's Opioid Project, I would like to be the first to welcome you to the 3rd Annual Opioid Summit. My name is Sara Szczotka. I am a co-chair for the Opioid Project. Outside of the Opioid Project, I am the program manager for the Washtenaw Recovery Advocacy Project, which is a recovery community organization located at Home of New Vision. Although this year's event is virtual, it is our hope that we are able to provide you a training that is just as valuable as it has been in previous years. I would like to take a moment to acknowledge the sponsors of this year's event. Without their contributions, none of this would be possible. So join me in thanking the Community Mental Health Partnership of Southeast Michigan, the Washtenaw Health Initiative, the Washtenaw County Health Department, Michigan Medicine, and Washtenaw Community College. I would also like to take a moment to acknowledge our Summit Planning Committee partners, Katie Abraham from Avalon Housing, Holly Standhart from MPRO, Ashley Schukreit from Unified HIV Health and Beyond, and Sharday Korhonen from Ozone House. Their hard work has overcome a lot of the challenges that I'm sure we have all experienced due to COVID-19. During last year's Opioid Summit, we had unveiled a community-wide needs assessment that looked at newly established programs, services, and funding streams, as well as conducting a root cause analysis of multiple aspects of opioid use. The Opioid Project published 19 community recommendations with 5 overarching goals. Through this process, we propose that our community look to fill gaps in access to non-opioid pain management options, addressing the stigma people with substance use disorders face, providing community education and primary prevention as it relates to substance use disorders, accessing medication-assisted treatment options to aid in the recovery process, and managing care for patients with substance use disorders within the relatively new prescribing guidelines. Since publishing these recommendations, I'm happy to say that we've made strides in our county to accomplish these gaps. Using feedback from the Opioid Project and many other organizations, the Washtenaw Health Department launched a media campaign aimed at stigma reduction and community education titled "It is Possible." The media campaign highlighted local people in recovery and their stories and was hosted on billboards, posters, short videos, and bus advertisements. The campaign materials included important public health messages such as never using alone, proper disposal of unused opioids, and the importance of everyone carrying naloxone. The University of Michigan's Injury Prevention Center, another opioid member organization, made publicly available a toolkit aimed at both providers and patients to facilitate patient-centered conversations around acute and chronic pain strategies. Another Opioid Project member organization, the Michigan Opioid Prescribers Engagement Network, or Michigan Open, also released a publicly available toolkit that provides resources on best practices for opioid prescribing. And as an organization, the Opioid Project updated our website to include many new resources for both patients, providers, and families, so we can become more familiar with resources in our area to help those impacted by opioid use disorders. Even though we have many strong allies and advocates, our work is not done. We still have some room left in order to accomplish our goal of ending opioid overdose in Washtenaw County. Despite the COVID-19 pandemic and all of its changes that it's brought, our member organizations have worked tirelessly to complete our mission. Throughout this year, and this planning process, the Opioid Project has developed a number of overarching goals that we will be working towards to accomplish within the next 2 years. One of our primary goals is that we will pursue is community education. Going forward, the Opioid Project will host at least 4 online seminars that is aimed at community education on a various wide range of topics surrounding substance use disorders and opioid use. These will be recorded and hosted online in a central hub in the hopes that we can have a centralized location for community specific educational content. It is our hope that we can build the capacity in our community to be educated and responsive to the needs of those struggling with this disease. Second, the Opioid Project plans to build further on the collaborations that it has going on every month in some of our meetings. In doing so, we are setting out to partner with community education, with community organizations who are launching new initiatives, elaborating on current initiatives, and facilitating collaboration between organizations that already do great work. In using a partnership framework, we hope to maximize the collective impact all of our organizations can have on our county. Especially in times when local and state funding can be uncertain, community collaboration is essential in providing services to the people that we serve. While these 2 goals are very important, perhaps the most important task we will be undertaking is to take an honest and hard look at racial inequality in our county and how historically unjust structures and practices have magnified the effects of substance use disorders for people of color in our community. Racial inequalities is not just a health issue, it affects education, housing status, employment, and the criminal justice system, to name a few, and makes it exceptionally hard for people of color in our community. We recognize that we have a lot of learning left to do. In the first phase of our action plan, we hope to learn as an organization to identify structural racism and inequalities that create barriers for people entering recovery. In our journey, we will challenge ourselves to look at issues honestly and commit to being proponents of change. We understand and realize that working on these goals may seem like a large undertaking. It is because of the contributions of our members and our member organizations that we are able to aspire to such high goals. Since taking on the role of co-chair at the beginning of this year, I've been truly amazed and proud at all of the hard work that everybody has put in on our shared mission. For those of you joining from Washtenaw County, we need you. So please join our coalition. There is a link in your program for you to join online. Like I said, our work is not done, and every member that joins is a valuable asset to our team and our shared goals. For those of you joining from outside of Washtenaw County, please do not hesitate to reach out. We really enjoy sharing our experience and our journey so far, and we would look forward to learning from you guys and what you're doing as well. So thank you again for joining us today. It is now my pleasure to turn it over to our other co-chair, Dr. Juan Marquez.
Thank you, Sarah. My name is Dr. Juan Marquez, and I'm the medical director of the Washtenaw County Health Department, and as Sarah mentioned, a co-chair of the Opioid Project. I would like to take a little bit of time to frame this year's summit. So, as a county's medical director, I've seen firsthand the widespread effects of the COVID-19 pandemic that has swept the county and the nation this year. Virtually every aspect of normal life as we knew it has dramatically changed overnight. Since the start of the pandemic back in spring, Washtenaw County has seen over 3,400 cases of COVID-19 in our county. Over 400 of these cases resulted in hospitalization, and 118 people have unfortunately lost their lives to this pandemic. There's been a disproportionate effect on communities of color. In a county where 12% of our residents are African American, 30% of our COVID deaths have been African American county residents. As we will explore this morning, similar themes of inequity are weaved throughout our response to the opioid epidemic. Although short-lived, the state of Michigan saw its first decrease in overdose deaths in recent years. Unfortunately, this was followed by a surge in opioid-related overdoses from April through June, likely related to the secondary effects of the COVID-19 pandemic. The initial decrease in overdose deaths was attributed to a 6% decrease among white residents, while the overdose death rate for Black residents actually increased by 14%. We need to ensure that equity is at the forefront of all of our efforts. One of the people who is most closely tracking the opioid data is my colleague, Adrian Waller. Adrian is an epidemiologist at the Washtenaw County Health Department. She's not only provided the much needed opioid overdose surveillance data that our public health team relies on, but she also takes the time to investigate the narratives behind the numbers. Her commitment to giving the full picture behind the numbers is invaluable as we try to craft solutions to the opioid epidemic in our county. She'll be walking us through the documented racial inequities in our county that are echoed by counties across the country. We are also fortunate to welcome Dr. Anaway LaBelle as our keynote speaker this afternoon. She has been one of the first to document the resilience of the recovery community in adapting to virtual support networks and maintaining personal recovery. This year's breakout sessions will take a more in-depth look at some of the other ways the COVID-19 pandemic has intersected with the full spectrum of the substance use disorder. We'll be looking at how our criminal justice system and many law enforcement agencies have adjusted their diversion efforts to stop the spread of COVID in our jails, while also providing ideas for future efforts on how we can help those with SUD rather than incarceration. We will also look at the many policy changes specifically related to SUD that were enacted in response to the pandemic. It is our hope that we can look at how these policies were coordinated and look at the long-term impact they could have on our community. As many K-12 schools in Washtenaw have moved to some version of online learning, we'll be looking at primary prevention and youth outreach in times where our youth are not connected to the in-person instruction we have historically relied upon. COVID-19 has presented many challenges in reaching people who are actively using drugs. With emergency departments reaching carrying capacity, caring for COVID-19 patients, looking at our harm reduction infrastructure is more important than ever. Lastly, we want to build upon exploration of stigma that we started in last year's summit. This year's session will explore how the stigma surrounding SUD manifests itself as internalized stigma in people seeking help. We are thankful to have a great coalition of partners that have helped shape the content of this year's summit. Through their input, we can investigate key issues and have a community dialogue centered around Washtenaw County, around helping Washtenaw County embrace people with SUD and provide hope for recovery. I would like to echo Sarah's call for people to join a coalition. The community's input is invaluable in helping us understand the community's needs, setting our priorities, and helping us shape our efforts moving forward. We need everyone's help to meet our goals of increasing community education and partnering with community organizations on shared goals and projects that will be most impactful for the Washtenaw community. As we wrap up our opening remarks, it is my pleasure to introduce Senator Jeff Irwin. Having a representative in state government who is committed to helping people struggle with SUD is critical in our fight to ending the opioid epidemic. Please welcome Senator Jeff Irwin.
Welcome to the third annual Opioid Summit hosted by the Washtenaw Health Initiative's Opioid Project. My name is Jeff Irwin. I'm the state senator for Washtenaw County, and it's my pleasure to join you virtually here today. This is going to be an important summit, and the summit will explore how COVID-19 has impacted substance use treatment and misuse, how it's affected recovery, and how our community can use this time to bolster our systems of support and our recovery community. And so it's an exciting opportunity to talk about an issue that is of tremendous importance to our community. We know that the misuse of opioids is an epidemic across the country, and it's a serious problem right here in Washtenaw County. In 2017, 2 times more people died of an opioid overdose than in car accidents. I think that's an amazing statistic. Zeroing in a little bit more on our community, in 2019, we had 62 opioid-related deaths in Washtenaw County. 62 people in our community lost their lives due to an opioid overdose. Every day, we have 1 to 2 average opioid poisonings reported. You know, 1 or 2 people every day is coming forward saying that they're having a problem with opioid overdose, just in our county alone. And when we think about some of the counties that are near us, much larger counties like Wayne County, and you start to extrapolate those numbers, you can see very quickly why opioid misuse is driving a whole lot of devastation and a whole lot of trauma and a whole lot of expense in our communities. You know, we know that in Washtenaw County between January 2011 and May 2019, so almost a 10-year period, we had over 300,000 emergency department visits in Washtenaw County, you know, reporting injuries with, you know, poisonings from drug overdoses and opioids. So this is just a tremendously important issue, and I think it's important to focus first on the ways in which opioid misuse impact our people and our families. I think it's important to focus first on the human element of how this is diminishing quality of life, and it's trapping people in addiction, and we need to help those people. But I think it's also important that we mention just how costly this is. You know, these hundreds of thousands of trips to the emergency department, these opioid overdose deaths, these responses by EMTs and paramedics, this is all tremendously expensive, and it's also taking energy away from other people who are in need and who need that help. And so it's a tremendously important issue. And I you know, what's causing it? I think that I'm certainly not an expert in this regard, and I know that this room is filled with people who have a tremendous amount of expertise on this issue, so I don't want to go too far on the limb, but to me it seems like this is an issue that is caused by poverty. It's an issue that's caused by trauma. It's an issue that's caused by depression. And I think the statistics bear that out. When you look at the folks who are getting caught in this vortex of addiction with opioids, a lot of times it's folks who are facing poverty. We know that people who are Medicaid eligible are more likely, if they have one overdose incident, to have multiple overdose incidents. We know that people who are Medicaid eligible have a higher rate of opioid overdoses. And so I just want to put it out there that part of the response to this, part of the solution, is going to be related to, you know, things like naloxone and things like medical response. But also, I think we need to think about the intersection between poverty, between lack of housing, between trauma in the home, and how that plays into people's tendency to fall into that vortex of addiction. If we're not talking about fixing those problems, I don't think we're talking about a full solution. So what is the solution? What is the solution for the opioid epidemic? I think it's multifaceted. Obviously, there's a number of these elements that I'm working on here in Lansing, and I really appreciate the work that so many of you are doing in the community to meet people where they are and to help people. It's tremendously important. And so what do we need to do? We need to expand the resources available. Lansing needs to do a better job. Washington, D.C. needs to do a better job. Your elected officials need to do a better job of bringing resources to substance abuse treatment programs and to, or, you know, staunching those other problems that are leading to addiction, like poverty. We need trauma-informed systems that intervene with people prior to their overdose. We need to be figuring out what are those triggers that we can see that are precursors to overdose, and how can we use trauma-informed systems to get in there and intervene prior to that. We need to provide families, friends, and community members with the tools to help and support individuals who are in need. That includes things like naloxone trainings and the availability of those opioid antagonists, but it also means that we need to be serious and diligent about trying to prevent and fight the stigma that is out there socially around substance abuse and substance use disorder in general. I think one of the things that happens that we need to fight against is that when folks start using, part of that that vortex that pulls them into addiction is that social isolation, is the fact that much of society looks askance at addicts or looks askance at people who are users, and reducing that stigma, I think, is easily as important, probably more so, than making sure that people have the availability and the knowledge of how to use in the lock zone. We also need to limit the civil and criminal penalties for people who overdose, people who bring in a friend who's overdosed. Those Good Samaritan laws are laws that I've been proud to be a part of improving here in Lansing, and we need to do more with that. Finally, we need to end the war on drugs. We need to have a whole different approach to how we help people live a better life, and creating immunity for low-level drug offenses, creating an opportunity for people to come back into society, an open door for these folks, rather than a closed door that drives them further into that vortex and into that subculture. Here in Lansing, I guess what I'm focused on in that regard, because I'm not harboring any illusions that I'm going to be able to end the war on drugs here in the next couple of years, given the partisan makeup of the body and given social attitudes about substance use. But there are some important things that we're working on that I think get us where we need to go. One of the things that we need to do more of, and we need to fund more of out of Lansing, is harm reduction strategies. We need to be aggressively funding programs like needle exchange. We need to be making sure that the resources are there for the community organizations to put real, thoughtful, caring human beings out in the community, making real connections with users. And part of that is providing resources and trying to make sure that people who are using aren't causing additional public health problems by sharing needles and other things like that they don't need to be doing. So harm reduction, needle exchange, funding those programs better. And then another one that I've been working on for the last year and a half since I got to Lansing is trying to do better in Michigan with medically assisted treatment. We have a dearth of methadone clinics or other medically assisted treatment providers in Michigan. I believe that's because Michigan's reimbursement rates for medically assisted treatment are very low compared to all of our Great Lakes peers. And so what I've been trying to do is to get those reimbursement rates up so that we can have more providers, so that people who are facing addiction, people who want help, can get help. Because one of the biggest problems we have right now is that we're spending a tremendous amount of money on both law enforcement and on court-ordered treatment, but it seems like there's never enough money to treat the people who are clamoring to get treatment, who are the ones who we know are going to be most likely to be successful. We need to make sure that the folks who are seeking treatment have it available. We should be a no-wait state for people who are seeking a treatment, especially when we're spending the lion's share of our money on court-ordered treatment, which we know is much less likely to be successful. So, fighting that stigma, providing more resources on the ground for human connections and for harm reduction and for medically assisted treatment are some of the things I'm focusing on up here in Lansing. And I just want to close this greeting by thanking all of you for the work you do. This is incredibly important. You heard the statistics here in Washtenaw County. They're alarming. And the amount of harm that opioid misuse is doing in our community is tremendous. And all of you have invested your time and your energy in trying to help people through this and to try to help our community through this. So thank you for that. And I also would invite all of you to connect with me. Most likely, if you're listening to this, I'm your state senator. And even if you don't live in my district, I'm happy to be your state senator, because if you've got information about how I could be doing a better job up here with the way we organize the budget or with the way that our laws work, I want to hear that, because it's helpful for me in doing my job up here when I hear from professionals who are on the ground, who know what's happening, who know what works, who know what doesn't work, and who are comfortable communicating that to me. So thank you for what you're doing. Thank you for taking your job as a citizen very seriously. And thank you for giving me the opportunity to represent you and to greet you today.
Good morning to everyone, and I'm really happy to be here today. Really excited about all of the work that the Opioid Project's been doing, and even in these rather difficult times. My name is Adrian Waller, and I am an epidemiologist at the Washtenaw County Health Department. Sorry, I'm just getting my slides ready here. And I've been with the health department for over 30 years, which has given me a really unique perspective in being able to see how things have changed over time. And so I was asked to come and talk about what's going on with the opioid epidemic, and I would like to provide some of that review regarding opioids, but I'd also like to provide a context regarding the health equity issues involved. I'd like to first thank the WHI Opioid Project co-chairs, as well as Matt Hill for arranging all of this. Strangely enough, I think that a Zoom version with technology might even be harder than an in-person conference, although he informs me that this is the first time we've ever been on time. So, been running on time. So, I'd also like to thank the Washtenaw County Health Department. Obviously, they have enabled me to do the work that I do. I would like to thank and express my gratitude to the RAP group. I've worked with a number of their members, and I can tell you that I'm much smarter because of them. I understand aspects of the opiate epidemic that I never would without their generous sharing with me. They're a great group, and so I encourage all of you to take advantage of all the information and insights that that group has. I'd mostly like to thank today a group that I've been working with for a number of years called the Community Voices for Health Equity Group. This is a group that was started by the Washtenaw County Health Department, and we are so fortunate to host this group. It includes approximately 12 community members from all around Washtenaw County. And these are amazing people who are community advocates. They don't necessarily work for nonprofit agencies, but they are really invested in improving their neighborhoods and their communities. These are people that it's really a privilege to work with them. The projects that they've initiated and carried out with no resources other than human capital. I'm just really grateful to be working with them, because not only do they ground me in the reality of what's going on at the grassroots level regarding public health, but they also elevate me because they are a group of optimists. And one of the things I've learned is that, so I'm going to be sharing a lot of information that feels like bad news. However, it is a call to action. And if we are pessimistic, we can guarantee that no improvement happens. So the optimism from these community advocates has really helped me to look up, look out, and really feel good about the human capital we have in Washtenaw County. So as I said, I've been with the department for about 10 years, and I've worked on a number of issues over that time. In the first decade, primarily worked on traditional public health things like communicable disease, perinatal health, environmental health. The second decade, moving into what was then considered cutting edge things regarding obesity, chronic disease, diabetes, hypertension. And in the last 10 years, I've really been able to focus my work on what is really drawing many of the years of life lost, causing premature death, and surrounding things regarding mental health, childhood trauma, social determinants, equity issues, as well as substance use disorders. So it's very appropriate that my career has taken those turns, because those indeed are the issues that are really driving a lot of the inequities. I'm really happy and excited and scared to share with you today, because this is a 1.0 presentation. I've never done this one before. I've done many presentations, but anytime I'm presenting for the first time on a topic, it's a little bit nerve-wracking, but I'm just going to try to interpret that as excitement. The information that I'd like to share today will all be summarized in a report called It's About Time, and you're looking at the cover of that report, and that should be published in the next couple weeks from the Washtenaw County Health Department. The background of the report is, some of you may remember a few years back, there were some really smart researchers who identified that for the first time in a long time, the average age of death, or life expectancy for white people in the United States was actually decreasing. And this made a lot of headlines because it was the first time in recent history this had happened. And what they identified were 3 causes of what they felt was the loss of life expectancy years. And one was overdoses, the second was suicide, and the third was liver-related diseases associated with alcoholism. So I wanted to really dig into that in our county. Our health officer, Jimena Lovelock, really encouraged me to look at the diseases of despair in our county. So I did that and found some really interesting and surprising things. And so I would like to share some of that. In the meanwhile, I started working on this report since about June of last year. And of course, then COVID happened, and because I'm an epidemiologist, I'm buried knee deep in that. But that is a huge equity issue, as we know. And then all of the sad and crisis events that have been happening regarding law enforcement and incarceration all suddenly added new chapters to this report. So I'd like to share that information with you. I'd like to start out with an overview of the opiate trends. But I'd also like to encourage everybody as much as possible to participate. Typically, I like to have a conversation when I present. This is a little bit more difficult, but I would like to encourage all the audience members to participate as much as possible. If you'd like to ask a question vocally, we can unmute you, or if you want to add to the chat bar. I recognize I've really had the privilege of all of the presentations I do are to people who know much more than I do about so many things. And so I encourage you to share some of that insight and wisdom that you have. But we'll also have a Q&A at the end as well.
They're able to hit the raise hand feature if they want to say something.
Oh, okay. So you can use the raise hand feature if you'd like to say something vocally, and we'd love to hear from you. Otherwise, just the chat box, right?
Yep.
Okay, great. So this is a sort of a summary of a lot of the information I want to share today. I appreciate that many of you may not be from Washtenaw County. And I have to tell you ahead of time, a lot of this is regarding Washtenaw County specifically, but I can guarantee you your own communities are experiencing many of these same issues. So these facts around the clock, I want to share some of the information with you today. We know that in our county, the highest COVID infection rate is in Ypsilanti City, which has the highest poverty rate of 33%. Things like that the median income for the top 1% of Washtenaw County households is 21 times higher than the remaining households average. We know that about a quarter of adult people who are incarcerated have a diagnosable mental illness. And we also know that there is a number of cost of living challenges in Washtenaw County, including things like we have the highest auto insurance rate in Michigan, and compared to all other states in the country. And then unfortunately, people who have a poor credit score have to pay an additional $500 a month as sort of a poverty tax in a way. So I'll get back to some of those in a moment. I'd also like to share with you that I include in many of my presentations artwork from people who are incarcerated. And I think I love art, and I can tell you that prisoner art is some of the most powerful art I've ever seen. Very coincidentally, today, the University of Michigan is opening up their prisoner art exhibit online as some previews. I really encourage you to take a look at that. They usually have a show every April, and I always go because it is extremely powerful. I'm gonna try to move this. So I will be including some of that artwork throughout the presentation, but I also think it's very relevant because many people who are incarcerated are there for many, many years, and we need to hear their voice. They are important and valuable, and we need to hear from them, and their art is a way of sharing that message. This is a portrait of Michael Thompson, who is serving time inside the Muskegon Correctional Facility in Michigan. And there was a newspaper article talking about him because he recently organized a meal for 50 of his fellow inmates to celebrate the George Floyd's life. So I wanted to share that. So just a quick overview of what I want to include today. First, an overview of the opioid trends, and then moving on to some of the health equity issues that, clearly there's a lot of intersection between substance use disorders and health equity. First of all, just a very quick overview. Since 2011, this is Washtenaw County residents, the number of opioid-related deaths between 2011 and 2019. And you can see here that in 2019, hopefully we're beginning a trend, a downward trend. I think there's been many groups throughout the county who have really been working on harm reduction, including the RAP group, including Unified, and the Southeastern Michigan, the Southeastern Michigan Community Mental Health, and I can't remember the name, but right now, but it is the Substance Abuse Agency for the whole county, and they've been working on these issues, many groups throughout the county. And so hopefully this downward trend will continue. So now I'd like to ask the audience participants a question. And as I said, we'd be happy to hear from you either by audio, video, or just by the chat bar. And the question is, in your observation, in the work that you do, have you seen outcomes, services, or care for people with substance use disorders change during the last 6 months throughout the pandemic? And I'm going to stop for a minute and let people raise their hand or include a chat in the chat box. Oh, I don't. Thank you. Is there a question or a response? Yes?
Increased use of telemedicine services.
Pardon?
Increased use of telemedicine.
Increased use of telemedicine services. So that's a great thing.
The waits for treatment have gotten longer.
Waits for treatment have gotten longer.
More focus on isolation and social distancing in the treatment setting.
A lot more isolation. I do know some agencies have been requiring a negative COVID test before people can come in.
Paul has something to share here.
Pardon?
Paul has something to share, so he.
Oh, great. So do I just
Say go ahead, Paul.
go ahead, Paul? Is he unmuted?
Yeah, Paul, just tell Paul he has to unmute himself.
Paul, you are unmuted.
He needs to unmute himself.
Oh, you need to unmute yourself.
There we go.
Okay.
Can you hear him? Can you hear me?
We may need you to speak a little bit louder, Paul.
I wouldn't know why. My picture is not on the screen. I'm not getting on the screen, but I can see the picture. I can see you again, but I'm not on the screen.
Yeah, Paul, I really apologize. I'd love to hear your question, but we're having trouble hearing you. It sounds like there might be a bad connection.
Some other comments, less available community mutual aid groups.
Less available community aid groups.
Available beds again, longer waits. Treatment centers are not able to be at full capacity right now because of.
Right. So treatment centers have reduced capacity, obviously. They're dealing with the same challenges that everybody are. So I'll just go ahead and move on, and I appreciate that input. And what I would like to share with you is what I've been able to identify in Washtenaw County, what has happened regarding deaths and emergency department admissions for opioid-related poisonings. And what I'm sharing with you here is both suicide as well as opioid-related poisoning, because I think the suicide, obviously, mental health issues are very closely tied to substance use disorders. And what I thought was really unexpected was the 61% decrease in suicide during January through May of 2020, and that's compared to last year at this time. However, with opioid-related poisoning, we really didn't see much difference, a tiny increase. We're still having about 6 overdose deaths a month. Now, what happened month by month? A lot of people are interested in exactly what happened each month. So this is what 2020, between January through August, regarding opioid deaths. And you can see in May, really seemed to be the peak so far. Typically, our average, as I mentioned, is about 6 per month, and May included 14. I'm sure that a lot of people will be studying what's going on, and we'll learn a lot from this very unnatural experiment that's been going on. I also wanted to share the 2019 to give you a little bit of context and perspective. Looks a little bit different. Obviously, we don't see the peak. I also was able to receive information from our hospitals, University of Michigan, as well as St. Joseph Mercy Hospital, Michigan Medicine, and St. Joseph Mercy Hospital. And so I wanted to take a look at a number of injuries and poisonings to make sure that we had some perspective. So I looked at things like assaults, suicide attempts, opioid-related poisonings, cocaine stimulant-related poisonings, as well as motor vehicle accidents. And as many of you have heard in the national media, that basically all emergency department visits decreased for chronic diseases or acute issues like heart attack or possibly even appendicitis, all those sorts of things. People delayed care, and it really had an effect on morbidity and mortality. What I think is really interesting is that each of these categories decreased, but at differing rates. So everything decreased. You can see here between January to May of 2020. And this is the percent decrease compared to January through May of 2019. So you can see here that in injuries and poisoning categories, that assaults had the least decreases, and that overdoses associated with stimulants decreased the most. And opioids are sort of right in the middle there. This is a graph looking at long-term of Washtenaw County and the emergency department visits associated with opioid overdoses. And I can tell you that the vast majority, almost all of the people who make it to the emergency room with an opioid-related overdose, they usually survive their overdose. But we can learn a lot for upstream prevention interventions about what's going on with those folks who do end up in the ER. And so what I'm showing you here are rates by demographic groups. You see here there's insurance, sex, age group, and zip code of residence. So these are rates. So I'm dividing the number of events in that group by the total population in that group. And what becomes very obvious is those who are on Medicaid and those who are Black or African American have higher rates than whites. We also see that people 65 and older are showing up at a higher rate for opioid-related poisonings. 48118 is the Chelsea area, Manchester, Chelsea, Manchester. The 48160 is Milan area, and 48198 is Ypsilanti City, Ypsilanti Township area. This is looking at if a person had 2 or more opioid-related poisonings during January of 2011 through May of 2019. I won't go into a lot of depth about my methodology here, but basically I was able to track people. And one of the things we know is very closely associated with opioid poisonings is trauma. And so as a proxy for childhood or adulthood trauma, I was able to look back in time to see if these folks had any sort of emergency department admissions associated with injuries or poisonings, not including opioids. So, and that's for people who had 2 or more opioid poisonings during that period of time. So what we see here is, again, those on Medicaid, males, and the younger age group at this in this group, and 48104, which is Ann Arbor, and the 2 Ypsilanti zip codes, 4819798. So how have things changed over time regarding race? Years of potential life loss is a really useful way to look at premature deaths. So basically what we do is identify a cutoff year. We expect people to, on the average, live to age 75. And if they die at age 70, that's 5 years of life lost. And these are rates, so they hold constant for the population. And we're comparing white males and black males between 2006 and 8 to 2016 to 18. So basically a decade. And we see for white males, the percent change, they increased 69%. And again, Washtenaw County residents. For black males increased 47%. So any chat or responses regarding how is poverty and substance use disorders connected? Love to hear from you, what your experience in your work and just your experience, observations. Yes.
Do any of the data points really surprise you, or are there things that we should be paying a lot of attention to right now for interventions possibly?
Can you?
For intervention.
Oh, yeah. Yeah. So for intervention, we need to be paying attention to.
I'm asking you.
Oh, you're asking me. I'm going to get into some of that. I want to hear back from everyone else first.
We had someone say not as much access to care.
Not as much access to care.
Structural racism and policies that prevent equitable services.
Structural racism and policies that prevent equitable access to services.
Chronic stress stemming from poverty can cause people to turn to substances as a coping mechanism.
People who turn to substances as a coping mechanism.
For the chronic stress associated.
Because of the stress associated.
Typically more trauma in poverty, which also leads to like self-medication.
More trauma for people who live in poverty. And poverty is considered traumatic also, especially those living in isolation.
Someone said we should also be paying attention to intergenerational poverty.
Intergenerational poverty, absolutely. It takes at least 2 to 3 generations to really improve the effects of poverty. Yes.
Is there trauma associated with racism that could be playing out?
Trauma is definitely associated with racism. The folks who are doing the research on adverse childhood experiences have added adverse childhood environments. Racism and poverty are 2 of those experiences. So definitely considered trauma. Anything else, Matt?
No.
Okay. Thank you, everyone, for participating with that. So you really covered most of these things that I thought about. Hopelessness, poverty also decreases social support. If you're working a lot, it's really hard to have time with family and friends. Also decreases access to health care, and that would be physical health care as well as mental health care. And we also know that poverty is very closely associated to police contact and the likelihood that you're going to end up incarcerated. So just some ideas. I want to share a video, and it's only 5 minutes long. It's about a young man named Marcel, and he actually lives in Camden, New Jersey. But what I really liked this 5 minute, he basically gives a really complete, sort of complete picture of what happens when you live in poverty. And he's clearly an optimistic young man, but I'd like to share this just so we can kind of switch gears from opioid focus only to more about health equity and social determinants. So hopefully this is going to work. There we go. Screen share.
You're watching UNICEF Television.
My name is Marcel Jenkins. I am 12 years old and I live in the United States of America. As I get older, I don't know exactly what I would like to be. I could go and be a very smart young man, but make one mistake and I could become a homeless man. So I'm just trying to see what life deals me. If it was my birthday tomorrow and I could have anything I want, I'd honestly say money.
The air freshener, $1. That's more my speed.
I don't really have a problem going to flea markets or a secondhand store. It's not like someone asks you, would you like to have this shirt? And you say no because that's used. I might say yes and wash it several times to make sure it's clean, and I'll wear it like it's brand new.
Sweater.
You should be able to wear it.
Yeah. And then put on my black jeans over church. Like,
Always jeans, no
that's
dress.
all I have, Mama. That's all I have. Remember?
My parents, they were in the streets on drugs, and they weren't fit to be parents, so I had to come and live with my grandmother. Every night I go in her room and give her a kiss goodnight and say goodnight and I love you, because I don't know if she's gonna wake up tomorrow. I constantly worry about my grandmother because she's done so much for me. In Camden, it's challenging because people are losing their jobs, people are getting laid off. That is not fair. These people might just be living off one welfare check a week, one welfare check a month, where you can't survive off of this money. I would change it that more jobs will be in Camden. I'd like to change the violence and the drug use in this community because some kids are being sucked in at a young age. You could be 10 years old and just playing outside. Some guys said, would you like to sell this stuff for me? and you don't know what's right and wrong. You have to think that your life is on the line every day. This kid just got shot. They might have just been in the way as a 4-year-old little kid playing outside. Could be in the crossfire and get killed. At school, lunch is something different every day. Burgers, tacos, a little bit of everything. It's harder to eat healthy than to eat junk, because junk is something that's always going to be there. Eating healthy, you have to pay. Sometimes your parents have to pay more, because that one year I had to diet for school. I was going to diet all year for school. My grandma paid, altogether paid $100 extra than she usually did, because she had to go buy no sodium lunch meat, no sodium cheese, special chips that didn't have any salt in them, and special things. I'm on medicine. I weigh as much as a grown man, maybe more. And I'm having health problems. They're watching me because I'm borderline diabetes, and they're trying to keep me out of trouble. And that's why now I'm going to get more active with my friends. Some of the downsides of being a 12-year-old in this country is that if you make one wrong mistake, that can be something that will follow you for the rest of your life. A lot of things aren't really attainable. The good things about me being 12 years old and an American citizen is that the world is sitting there waiting for me to come and change something, or for me to come and do something good.
For more information, go to unicef.org. Unite for Children.
Oh, thanks. Great. Up one. I hope that all of you can appreciate the why I chose that video. Marcel is a brilliant young man, and he's only 12 years old. I need a technical intervention here.
Technical adjustment. There we go.
Thank you, magician. I think Marcel touched on probably 15 or 20 issues in that very short video. The importance of having a healthy relationship with a healthy adult like his grandmother, issues regarding being overweight and the connection with poverty, having parents who were unable to care for him because of their disease. He recognizes the risk of incarceration if he does just one thing wrong. The exposure to violence, but his optimism and his sense of responsibility regarding he has a place for making things better. So I thought that Marcel was great at transitioning us from moving into a little bit more of the equity issues that I shared with you, that I told you I'd be sharing with you. So time is the most precious universal resource that we have. One of the things that's really startling in Washtenaw County is that the structural racial inequities, and long-standing inequities. And in fact, in Washtenaw County, for Black and African Americans, the average age of death is 66 years old. And if you think about that, the age of eligibility for most retirement benefits, including Social Security, is age 67. And so you can see right there, even the inequity of not being able to enjoy your retirement and not being able to enjoy all of those resources that you contributed to our public systems, not to mention the sorrow and loss of someone's wisdom and experience to share with their family members. And so hopefully the It's About Time report will help to provide additional information, a call to action for how to reinvest and refund our community to eliminate these disparities. And we know that they are profound, we know they're longstanding, but we also know that these inequities were created. And we also know that they're predictable. Anything created can be deconstructed. Anything that's predictable can be prevented. So we need to do the work, and we need to, many people have been working on these issues for years, and we need to make sure that those working on these issues get the resources that they need. So first of all, I'd like to just talk about 50 years ago, and what was really surprising to me in my research is that the 1970s were about 50 years ago. That was astounding to me. But in Washtenaw County, the white residents' average age of death in 1970 was 64 years old. At that same time, the average age of death for Black persons was 47 years old. As we move up to present, in 2017, white residents lived to about age 76 on average. And in 2017, Black residents finally have achieved the same age of death that white people had back in the 1970s. So that is a huge gap. We also have, we don't have complete information about our Latino neighbors. Earlier in the 1970s, I'm not sure if the issue was there wasn't enough people living here, or fortunately that there wasn't many deaths, but we only have the newer data. And in 2017, the average age of death for our Latino residents is age 60. Obviously, even greater disparity there. So I would like to share, we have an amazing researcher who resides in Washtenaw County, who's been working for the University of Michigan for many years, and her research on weathering and health inequities has been really critical nationally and internationally. And her name is Arlene Geronimus, and I want to share a quote from her. Growing inequity in life expectancy reflects the weathering effects of deepening and prolonged structural inequity and the cumulative physiologic effects of the persistent high effort coping, such as inequity entails over the life course. Income inequity has been shown to be a particularly powerful driver of life expectancy disparities. So I appreciate that, Dr. Geronimus, and I think it really sets the tone for the framework of these issues. want to step back and going back to the story about working on the issues of diseases of despair in Washtenaw County. As I mentioned, I wanted to look at what was going on in our community. And in particular, I wanted to look as it relates to poverty and income. So again, using years of potential life loss rates, I wanted to look first at what was going on in low poverty census tracts in Washtenaw County. These are census tracts that have 0 to 5% of the residents living in poverty. And so what you see here really does reflect what the diseases of despair discussion is about, with the exception of the liver disease related. Indeed, during this past decade, unintentional injuries, which is largely made up of opioid overdoses, did get worse for this group, as well as suicide, premature death. However, when I looked at high poverty census tracts, which is census tracts with 20% or more of the residents living in poverty, what I found was every single leading cause of death got worse. We're all used to knowing about the unfortunate disparities in health in Washtenaw County, in Michigan, in the United States, and in the world. But knowing that they're actually getting worse is really astounding to me, especially with our greater understanding of really what's going on. So one of the things that contributes to these inequities is where you live. This is a map of Washtenaw County, and these are all the municipalities. And I've plotted these by the average age of death during 2016 to 2018. And what you can see here is Ypsilanti Township has an average age of death of 66 years old. We also know that Black people who live within Ypsilanti Township, their average age of death is 63 years old. So the disparities here are marked, and I've been fortunate enough to be working with a local historian recently, Matt Siegfried, who's been sharing with me amazing stories about the inequities that have been going on for decades in Washtenaw County, hundreds and hundreds of years, essentially, and the structural policy decisions about where we put our highways and basing our school systems on real estate values. There's currently, just recently, a story of a zip code on the east side of Washtenaw County that wants to have an Ann Arbor zip code rather than the 4819798 Ypsilanti zip code. To me, that is a very current, obvious piece of evidence that people understand structural inequities, and they don't want to suffer because of them. They don't want their real estate value to go down. So these are very persistent. We also know when we look at the municipalities over time, between 2013 and 2018, that actually the municipalities that have the youngest average age of death are the ones that are declining. We have great opportunity to work in those areas. So one of the things I've been wondering is, for instance, when we look at obesity and overweight, there are some ethnic groups that actually suffer morbidities at lower weights and lower BMIs than other ethnic groups. And so actually the scientists that have lowered the threshold for where somebody is considered to have overweight or obesity, because we know that those people will suffer at lower weights. I wonder the same thing about the benefits that we receive in our community that are associated with being older. If our average age of death for African-American Washtenaw County residents is 66 years old, is it unfair to wait until 67 to provide these benefits for folks? And also Medicare, a number of benefits associated. So I'd be very happy to hear some feedback from anybody who'd like to contribute regarding this.
Should have some Jeopardy music.
Right.
Somebody said, I think that's a brilliant example of being equitable.
I think that's a brilliant example of being equitable. One piece of feedback, thank you. Okay, we can move on. Thank you very much for that input. I know it's a tough question, but I heard once the description of equality is giving everybody a pair of shoes. Equity is giving everybody a pair of shoes that fits them. So this is sort of reminiscent of that. So what are some of the health burdens that are really driving and accelerating these disparities? So in Washtenaw County, we have a survey we call the HIP survey that really helps to look at some of the intermediate conditions that are happening that are then leading to these life expectancy differences. And so between 2010 and 2015, the HIP survey showed that Washtenaw County Black and African American residents had a number of issues that worsened that are probably very likely associated with some of these outcomes we've looked at. And many of them are proxies for a lot of other things. A decrease in the proportion of people getting a flu shot, routine checkup in the past year, having the emotional and social support needed. The World Health Organization recently added social support and social capital to the list of social determinants that are most important in producing and driving health. Increase in diabetes diagnoses, disabilities, fair or poor health. Fair and poor health, when you describe your own health, it's actually very predictive of health outcomes. And then also reduce food intake due to cost. And Marcel talked about the challenge in eating healthier, low sodium food, so not surprising. So as I mentioned, working on this report, these things that were happening in real time, really my original intent in the report was not to include aspects of COVID since we didn't know about it, but we certainly do now. And Washtenaw County is no different than any other community in the United States. COVID has been a heat-seeking missile for people in our county who were already vulnerable. One of the things I've realized in public health over my 3 decades is that you can absolutely guarantee that almost every public health issue is going to impact people who are already vulnerable much more than anyone else. And so when we are entering into health challenges, we might as well just start right then to really address the importance of those predictable impacts. So in Washtenaw County, between March and July of 2020, we saw that the African-American and Black residents who were hospitalized were much younger than their white counterparts, about 8 years younger in general. Also, once once these folks were hospitalized, they also were more likely to be admitted to an intensive care unit, have mechanical ventilation, have a diagnosis of pneumonia, multi-organ dysfunction, and sepsis and death. So we know that if populations start out with comorbidities, they're much more at high risk for both infection as well as poor outcomes. But we also know that COVID itself creates new comorbidities. And we really don't know how much, but we know that they include respiratory, liver, kidney, neurologic, psychiatric, and the list goes on. So we really need to pay attention to how to manage those comorbidities. So Washtenaw County, again, it's very representative of the rest of the country regarding issues of law enforcement and correction systems inequities. One of the things that I thought was really striking is some research that I read suggested that for every year that a person is incarcerated, it takes 2 years off of their life. And we have so many people incarcerated in the United States and have had so many people incarcerated in the United States, it's actually reduced life expectancy in the US by 5 years. It's had a huge impact. And I can tell you 5 years in life expectancy statistics is huge. We also know that, let's see, move on. In Washtenaw County, Black children are 6 times more likely to be arrested than white children. And when I say children, I mean children, 10 to 16 years old. We have huge disparities here. We also know that people who who have more trauma, ACEs, and people who are incarcerated are much more likely to have high trauma scores. They are 50% of juveniles arrested have 4 or more ACEs. And this is compared to 10% for the general population. We know that people who have 6 or more ACEs also live 20 years shorter lives. So the math adds up here. We also know that toxic stress, or as Academy of Pediatrics says, the excessive or prolonged activation of the physiologic stress response systems in the absence of buffering protection afforded by stable, responsive relationships. So part of the good news with ACEs is stable, responsible, healthy relationship with a healthy adult is really a buffer. So we know that in our jails, the people, while there's only 12% of Washtenaw County residents that are Black, 58% of those who are incarcerated are Black or African American. We know that even a few years back, the county jail, the sheriff did a study and was able to identify that about 75% of the people incarcerated had a substance use disorder, about 63% were unemployed, about 36% had no high school diploma, and also for adults, about 25%, as I said, have a diagnosable mental illness. For youth, it's about 75%. There was a Michigan study that showed about 75%. We also know that the community to prison pipeline is in large part built on recidivism. So in other words, you've been arrested more than once. So juveniles, children who are arrested in Washtenaw County, about half of them recidivate. are arrested more than once. And according to the Juvenile Detention Center, the vast majority of those re-arrests are associated with the original arrest because these kids are not always able to pay their fines, or they're not necessarily able to attend the hearings that they're supposed to. And in large part, they have to rely on their parents, which may be difficult in a low-income family to get to those hearings. So this is a huge issue that we really need to deal with locally. So I wonder if there's some opinions out there about what kind of things we need to consider when we're having discussions about reprioritizing resources related to law enforcement and root cause of substance use disorders and crime. So I'll take a moment and let people contribute if they would like. Okay, are we getting any responses?
Not yet,
Not yet? Okay.
but people might be typing.
Okay, we'll wait another minute. And as I said, there will be a Q&A.
More social workers sent to houses instead of police officers.
More social workers sent to houses rather than police officers.
Centering the voices of community affected to highlight criminalization of health-related issues such as SUD.
Centering the voices of community members affected.
Highlight the criminalization.
To highlight the criminalization of substance use disorders.
More money to go into prevention and treatment instead of dealing with the problem of law enforcement when the issue has already progressed. More social workers, treatment professionals there to assist. More resources going into prevention rather than law enforcement. Letting the vulnerable lead the conversations, especially those marginalized, like Black trans women.
Can you say that again, please?
Letting the most vulnerable lead the conversations, especially those the most marginalized.
Letting the most vulnerable be part of those conversations. When I assume making policy and funding decisions.
More positive interactions with police.
More positive interactions with police.
Deferment programs utilizing peer recovery coaches for SUD cases.
Deferment.
Deferment of criminal charges.
Diversion, deferment programs.
A paired up social worker and law enforcement officer as kind of like a team.
Having social work, law enforcement teams.
Cultural sensitivity training, allowing ASO/CBO to continue to provide resources to improve health equity with better support for law enforcement.
So cultural competency trainings. And how about one more, Matt?
Individuals are not well connected with, to resources when they're coming out of incarceration and usually need more resources and support, not less.
So post-incarceration, people really need resources immediately. And unfortunately, we have had a number of people overdose and die after they've been released from incarceration. Okay, thank you for that input. I'm looking forward to hearing more about that. So one of the things that is profoundly true in Washtenaw County is it's very expensive to be poor. And so going back to the years of potential life lost due to drugs, this time I'm comparing the low poverty census tracts again, the 0 to 5%, to the high poverty, and during the past decade. And what you see here is that those in low poverty, the increase was about 37% during that decade. For high poverty census tracts, it was 4,260% higher years of potential life lost, the rates. But what was also interesting to me, and those rates hold constant for the size of the population, but what was even more profound to me was when I looked up the proportion of people in those zip codes during that decade. At the end of the decade, 36% fewer people lived in low poverty census tracts. During that same time, 58% more people lived in high poverty census tracts in Washtenaw County. That's astounding to me. So either they became impoverished themselves, their census tract became high poverty, or they had to move into areas that had lower rents, lower mortgage rates, that sort of thing. So Washtenaw County has a great reputation nationally for many reasons, well-deserved, but we also have a problem with helping those move out of poverty. And so one of the things that these measures include are geographical disparities, segregation, income inequality, school quality, social capital, and family structure. So this is the map of the United States, obviously chopped up by counties. And this is a measure of upward mobility. In other words, the chances of somebody at the bottom of the income groups reaching the top. And basically Washtenaw County has the worst rate in the country, along with many other counties who are also in the lowest category. So we don't lift people up very easily. Washtenaw County is among the worst counties in the United States for helping poor children move up the income ladder. Only 8% of counties do worse than Washtenaw County. So for instance, if a child in a poor family were to grow up in Washtenaw, instead of an average place, he or she would make $2,630 less by the age of 25. Washtenaw County has significant income inequality. A few years back, we were 5th in the state for highest income inequality. We've now moved towards 3rd, and hopefully we won't become #1. We know that half of the income is concentrated in 10% of the households. So I think we're running low on time. Is that right, Matt?
Yeah, we have about, you can probably take about 10 more minutes.
Okay. So I'm gonna just hold on getting questions from here. I'm guessing based on the responses that you have all shared that you have a lot of experience and understanding of income inequality in Washtenaw County and how it reduces social mobility. So looking at housing as another reason for why it's hard to be poor in Washtenaw County. Between 2008 and 2018, the median household income increased by 6%. At the same time, the median housing price increased 44%. You can obviously see the gap in our ability to have stable housing. We know that people who spend over 1/3 of their income on housing are considered cost burdened or housing burdened. During these 10 years, 2005 to 2015, we know that 25% more households were cost burdened and spent 1/3 of their income on housing. When is really important, as I mentioned, to talk to really engage the community to know what's going on, what's making it harder to be poor in Washtenaw County, and of course related to these life expectancy disparities. things like auto insurance are really important. And I know there's some laws changing right now, and I'm hopeful that this will improve. But we do know that Michigan has the highest auto insurance rate in the country, significantly higher. We also have, as I mentioned earlier, a $500 monthly insurance penalty for drivers with poor credit rating. So if you're impoverished, you are punished for that. So that might make it very difficult to buy auto insurance, which might make it very difficult to get transportation to a good job. And then if you do drive without insurance, you may be more likely to be stopped by the police and arrested or charged with driving without insurance. So you can see how that cycle might go on and on and on. So so we can discuss this at the end. Again, what changes are needed regarding insurance coverage for access to substance use disorders treatment, especially for those who have few resources. We know that out-of-pocket medical costs and medical debt has reduced ability to receive needed health care. Anymore at this point, when I hear that a percent of people who have health insurance, I kind of ignore it, because health insurance anymore is almost like distracting from the fact that you can't afford health care. Out-of-pocket costs, deductibles, premiums may be so expensive that one might prefer to not use their insurance because they're likely to not be covered for that service. We know that on average, the medical expenses increased from $965 to $1,125 during the past decade. This was a really interesting study that the New York Times did, and they surveyed 2,500 non-elderly adults about health insurance. And they wanted to know, how is it really affecting you? And the people who had no health insurance, it was really profound what they found. 53% had problems paying medical bills. 62% had debt of $2,500 to $10,000 regarding medical costs. And this debt has a huge impact on their self and their family as it relates to providing food, clothing, housing, utilities. These are huge issues. And then 41% delayed or did not receive needed medical, dental, rehabilitative care or prescription drugs needed. As I've shared with you, people who live in poverty are sicker and they die younger. So they obviously have more comorbidities. And if you have health insurance that isn't useful, you're less likely to get the medical care you need. Also, if you have medical debt, you don't want to make an appointment with that doctor because you're very sheepish about going in when they see that you have an outstanding bill. But what was even more surprising is people with health insurance, 20% had problems paying medical bills. 51% had the same amount of debt as those without health insurance. Almost the identical amount had the medical debt had a major impact on their families as it relates to accessing food, clothing, housing, utilities. And 26% of people with health insurance delayed or did not receive medical care, needed medical, dental, rehabilitative, or prescription drugs. So I hope I've shed a little bit of light on why some of these life expectancy disparities exist in our county, or inequities. And inequities is, the definition of inequities is that they are preventable and unjust. And we clearly have huge inequities here in Washtenaw County. These are getting worse. They're not getting better. And a huge driver of that is the income inequality in Washtenaw County. It makes it very hard to have resources to pay things like rent and food and childcare in a community that has a high overall average income. So I didn't cover everything. There are many other factors that really drive these issues, but hopefully this will provide a little additional information. As I mentioned, the It's About Time report will be published very soon by the Washtenaw County Health Department, and we look forward to hearing back from you about what your work in the community regarding health inequities. Thank you. I really appreciate all of you listening. Even if you were doing housework while you were listening, I even appreciate that. So.
Do you want to see if anybody had any questions?
So we're gonna have time for questions.
Just a couple questions here. All right, if anybody has any questions, they can go ahead and submit that into the question and answer portion on Zoom, and they will pop up for us here.
We'll give you a couple minutes, and doesn't have to be questions, maybe comments, things that you disagreed with, felt that I did not describe correctly. Be happy to have any of that input. I really appreciate everybody's input on the chat boxes. I hope I can keep those. I hope I can keep a record of those. Okay, well, I sort of feel like if anybody had a question, they would. Is there a question?
What? Right there. Okay. Right there.
Oh. What comes of reports like this? How do they inform programs and policy? Well, my experience with reports in the past is sometimes they're used and sometimes they're not. It's going to be useful for some groups and not for others. My hope is that the information will really help to inform new initiatives, old initiatives, and certainly the report is not comprehensive, so I don't expect people to consider it. So my experience is that reports like this do in part help to inform policy and decision-making, but not for very long. They seem to have a pretty short shelf life. Thank you for that question. And I'd be interested in your opinions, Brooke, regarding the answer to this as well.
Well, it looks like that was it.
Okay. Well, thank you, everyone, and everyone here for your patience and participation. And thank you, Matt. You're pointing.
No, I'm coming.
Oh, okay.
Behind you.
Okay. And everybody have a wonderful day.